and welcome to Talk Trillium. My name is Patty Cochran, Senior Vice President and Chief Innovation Officer at Trillium Health Partners. Trillium Health Partners has 3 sites, 2 in Mississauga, the Mississauga Hospital and the Credit Valley Hospital, and the Queensway Health Centre in Etobicoke. I'll be your host on Talk Trillium as we speak about how Trillium Health Partners is working to create a new kind of healthcare for a healthier community. Today's show is all about mental health, and it's my great pleasure to introduce our guest this morning, or today, Cara Vaccarino. She's the Program Director for Mental Health at Trillium Health Partners. Welcome, Cara.
Hi, Patty. Thank you.
And Dr. Rose Geist, who's no stranger on our show. Dr. Geist is the Program Chief and Director of the Mental Health Program at Trillium Health Partners.
Hi, Patty.
Hi, welcome. Maybe to start, Cara, you know, the whole topic around mental health has been behind closed doors for the most part. And now all of a sudden it seems to be more on the forefront of every healthcare discussion across the country. Can you tell us a little bit about why you think that change has happened?
Sure, Patty, thank you. So first of all, and I'm sure Rose will agree wholeheartedly that it's a refreshing change in the tide. We had gone for many, many decades, as you said, with discussing the whole issue of mental illness and addictions as well, behind closed doors. I think for the most part, public awareness has increased largely due to very strategic educational initiatives. Here in Canada, the Mental Health Commission of Canada has been very deliberate in terms of its anti-stigma and education program. In 2009, they launched a program called Opening Minds, which really brought together some of the most activated citizens across the country in terms of bringing out much more awareness and education regarding mental illness and addictions. A lot of high-profile people here in Canada and across North America have come out and spoken to their own stories regarding mental illness and addictions. So I think that just more awareness has created you know, a lot more conversation regarding, you know, even prevention of mental illness.
Now, you mentioned the word stigma, this stigma around mental health. Any advice of what we could do differently, both individually and collectively, around the stigma around mental health?
Sure. Well, stigma can be defined as a negative stereotype. So these are perceptions we have, sometimes reinforced in the media, around issues with addiction and mental illness. I think that education is a huge part of destigmatizing mental illness. The more people can really relate to issues around mental illness as diseases and disease processes and illnesses, just like diabetes or other issues such as that, I think that could really create more awareness and less stigma.
So, Dr. Geist, I think maybe partially because of the stigma, many people go often undiagnosed with their mental health illnesses. Can you tell us or give us any advice to someone who might think that they have a mental illness? What would they do? What would be their first step?
Well, the first step is to recognize that there's a change going on within the individual. And as Cara was saying, stigma really applies to individuals as well as to the society. And many persons aren't comfortable recognizing a mental health issue that's emerging within themselves. So the first place to start is to feel more comfortable with mental health issues that may occur within the individual. And they manifest in different ways. Some people begin to feel anxious or depressed. They start to have thoughts that are uncomfortable. Other people develop physical symptoms, abdominal pain, headaches, backaches. What's really important, though, is to recognize that there's been a change in the way you feel or you think, and it's interfered with your ability to function, to sleep, to fall asleep, to stay asleep, to go to school, to be social. All of those functional parts of one's life change when there's a mental health disorder.
Now, I think the words "I'm stressed" is something that we all say from time to time. And we're often stressed because of work life. We're often stressed because we're perhaps in the sandwich generation looking after young children and older adults. We could be stressed because of school. How do you differentiate between what could be interpreted as normal stress versus stress and anxiety that's more along the mental health line? When does it become a little bit more abnormal?
Well, usually there are two factors that you consider. One is the duration of the symptoms. So if one starts to feel different and it persists over at least a 2-week, 3-week period of time and there's no change, then you start to wonder whether there's a mental health disorder, which is different than an acute stress reaction or situation. The other thing is when the symptoms themselves become very severe, so that during a stressful event you might feel anxious, but if those anxiety thoughts or feelings become very severe to the point that they interfere with your functioning or your ability to tolerate those feelings, then you're entering into the world of a mental health disorder. It's very important to be aware of one's family history, because if you do have a positive family history where other members of your family suffered with a mental health disorder and you start to develop symptoms, then they may take on a different meaning other than an acute stress in one's life. Now, it's very important for us all to realize that even stress can be overwhelming. That doesn't mean you have a mental health disorder. We all have times in our lives that are more difficult to cope with. That doesn't mean you have a mental health disorder. So it's important to be able to talk about it, to discuss it with people you're close to, and to get a perspective on it, or to go to your family physician who can always give you a context or perspective.
So like many other illnesses, your family physician is often the first step towards getting subspecialty help and assistance.
Right, and actually the family physician, especially if you've had a family physician for a number of years, is the person you trust, the person who knows you best, and the person who can put a context into a change in your functioning, whether it's a medical change or a mental health change. So our family physicians are extremely important in our mental health system.
Great. So Kara, with the incidence of mental health being about 1 in 5 in the population, what are the common types of mental health illnesses that we see in our community?
So the most common challenges people face in the general population are anxiety and depression. So these are the most common issues that we treat at Trillium Health Partners in the mental health program as well.
And what are we doing around those mental health? Are there programs or services that people can reach out and get some help with?
Yes, Patty. So it's very important, I guess, to broadcast that there are a lot of excellent treatments for anxiety and depression. People can get very effective help, they can get support, and they can get better. What we do primarily at Trillium Health Partners is we offer patients, first of all, a consultation with a psychiatrist in a team-based approach. So we have an interprofessional approach in all of our programming, which brings together nurses, social workers, occupational therapists, psychologists, and psychiatrists to really offer clients different perspectives and tools that they can use to move forward in their recovery.
That's wonderful. Thank you so much. And I imagine that some people need help in their homes, right out in the community. Do we offer services out in the community for patients?
We have a couple of programs at Trillium Health Partners that do feature community outreach. We have a seniors mental health program that has an outreach component. This is particularly important for seniors. Oftentimes seniors have difficulty accessing hospital-based services. They may be homebound, they may have transportation issues, so outreach for that population specifically has been very effective in getting people better. We also have assertive community treatment, which is a program for people with more chronic or disabling mental health concerns. One of the primary objectives of offering assertive community treatment, or ACT, is really preventing crises, helping people stay in the community, avoiding hospitalizations, and really, again, using an interprofessional approach, a wraparound service to really reach out and provide treatment in one's home or community.
That's great. Dr. Geis, I'm wondering if you could share with us a little bit more around this new initiative called the Medical Psychiatry Alliance. I understand it's a partnership with some other partners. Can you just briefly describe that initiative for us?
Well, the Medical Psychiatry Alliance is one of the most innovative initiatives that Trillium Health Partners has actually been a major player in putting together. And what it's about, it's a partnership between CAMH, the University of Toronto, the Hospital for Sick Children, and funded by a very generous donor in the Ministry of Health, that over the next 5 years, our plan is to transform how health is delivered to a certain population of patients. Those patients who suffer with both medical and psychiatric illness, or those patients who have what we call medically unexplained symptoms. And this is a very large group of patients who have not been well served, who fall through the cracks, and who visit the emergency rooms and their family physicians, and often are left with the feeling that they haven't been understood or they don't know where to go. So the initiative itself is very exciting, it's innovative, and it's our opportunity to really change how health is delivered and how mental health and physical health, when they occur together, is delivered to the population.
And when would we be able to see some of the new programs or services for the MedPsych Alliance start?
Well, our plan is to begin running them in the spring and summer of 2015. So it's just around the corner, and there's been a lot of thinking and planning and integration and people working together to put this really exciting initiative together. But we're hoping the spring, the summer, we'll be able to see some real change.
That's wonderful. What a great initiative. And again, it's about partnering with others as we create a new kind of healthcare for a healthier community. The partnership with CAMH. CAMH stands for, again?
The Center of Addiction and Mental Health.
It's located in Toronto, University of Toronto, and the Hospital for Sick Children's. Very admirable work. So thank you very much.
Pleasure.
And just please stay tuned. We'll be continuing our conversation around mental health after the break. Welcome back to Talk Trillium. Joining me now is Anita Stalinga. Anita is the VP of Community Investment for the United Way of Peel. And again, Kara, thanks for continuing to join us today. In my hands, I have a report from the United Way Peel Region, and it's called Mapping the Mental Health System in Peel Region, Challenges and Opportunities. This was published in January 2014. Can you tell us a little bit, Anita, what inspired the United Way to author this report?
We really wanted to understand the issue around mental health and access to community-based services across Peel. And we knew from our own research and consultations that we had had in the community about the issue of mental health that there were significant gaps and challenges in the system. There were long wait lists and often services were not available. So we really wanted to understand what the mental health system looked like, how do people navigate it, and particularly we also had a lens in the report around how particular diverse communities, especially the South Asian, Chinese, and Black communities, experience the mental health system and what resources and supports are available for them. So that was really the motivation behind this report.
And what findings did you come across? Anything that surprised you?
Well, it was really interesting because it validated a lot of the things that we had heard in the community, and it was surprising in many ways the degree to which there was such a significant gap in community-based services across Peel. So for such a large population, we found that the services really are not available to meet the needs of a growing, diverse community. We found that wait lists for some services could go up to as high as 2 years or more for somebody that was looking for support for themselves or for their family. We also discovered that some services were just not available in Peel region, and people had to travel either to Toronto or to Halton region to access those services, and that was a huge barrier as well. And we also found, in terms of the culturally appropriate services, that there was a gap in terms of what was available, but also learned a lot about the stigma around mental health that exists in our communities. And so this report really helped us think about ways to overcome some of those and use approaches that can benefit our residents.
Now, is our community any different than other communities within Ontario?
I think the issues that we experience around mental health are the same. We know that 1 in 5 people will experience mental illness. In Peel region, that means that that's about 260,000 people. However, I think the unique and the differentiating piece for Peel is the fact that we have always struggled with access to services. We've always had a gap in terms of the kinds of services that are available and having the appropriate funding for those services. So the wait list is long, extremely long, and that's unique to Peel. The fact that we don't have some key services available in Peel is unique to Peel. And the fact that we have such a growing and diverse population, and the issues around community support and approaches to supporting people around mental health that need to be different are also unique to Peel.
So where would the recommendations from this report go?
Well, we had a broad steering committee that helped us with this report, that worked on preparing the report and the recommendations. And since then, we have shared this report very broadly with our key stakeholders to increase the awareness about the report, to share the recommendations. In some cases, work was already unfolding around some of the issues that we had identified. So it was a way to provide the validation and the support that they needed to get the work done. And really to bring the accountability and the responsibility for responding to those recommendations to various community groups and organizations and partners, because there really isn't one solution, one simple solution. It's a complex system, and it has many partners and many parts in the system. So I think for people and organizations to be aware of those challenges is a starting point, and then to look at what part of the pie is theirs in terms of the accountability and the support, and then what do we do knowing what this report has flagged for us, what can we do about it, and how do we do it differently?
Excellent. So Kara, as the Program Director for the Mental Health Program at Trillium Health Partners, how has Trillium responded to this report?
Okay, well, first of all, I'd like to acknowledge the excellent work of United Way. Prior to this report, we hadn't had a comprehensive profile of the challenges that exist in our community. So it has been a tremendous information that we have employed in program development and planning. One of the most significant, I guess, developments that we have made pursuant to this report is really around access to services for children and adolescents, particularly children and adolescents who come to Trillium Health Partners in crisis through our emergency department. One of the primary findings of the report was really the need to create strategies around emergency department diversion. So what we've been able to do at Trillium Health Partners is we've been able to develop an urgent care program for kids so that they can either be seen very shortly after they leave the emergency department for follow-up. Follow-up that may have taken 6 to 8 weeks before now takes place within 72 hours post-discharge from the emergency department.
Where is that urgent care center?
So the urgent care center, or access to urgent care services, is accessible both at the Mississauga site and the Credit Valley site. Okay. So that's been a huge improvement. We've also been able to enhance some of our urgent care follow-up for adults as well. We have a ways to go, specifically in terms of developing programs specific to address the diversity in our community, but thanks to the United Way report, that's definitely on our radar for the future.
And Anita, are there special challenges for the newcomers in Peel? I think we have a large population of newcomers. Can you speak to that diversity?
Yeah, absolutely. There are actually quite a number of challenges facing our communities. The issue of mental health, mental illness, and how it is understood in diverse communities is very different from the concept of mental health and mental illness in the Western world. And I think it's really key for us as we think about designing programs and supports and services and how people access that really has to be different. There's a great deal of stigma around mental health and mental illness in various communities, and understanding that stigma as a barrier is key for all of us, but in particular, how do we deal with that stigma from a perspective of the community, the family, and the individual, because those are so strongly intertwined within diverse communities, and the faith community plays a significant role around mental health and mental illness as well. So there are so many considerations around that, and one of the recommendations for us in this report was to really look at approaches and involving the community within the diverse communities to speak about mental health, to speak about mental illness, to share stories about experiences that individuals and family members have experienced themselves, to break the stigma, to break down the shame around the mental health that many of us experience, but then to start conversations about what to do, how to support the individual, how to support the family, and where to access supports and treatments in ways that are culturally appropriate and responsive. And I think that the conversation has to happen, and it has to happen at many different levels, from leaders, from faith community, from individuals that have experienced it, that are able to share on a individual to individual, family to family basis, so that we're able to speak about this and really seek the support that's there. So our recommendation is really around this community development approach to engage the community to speak and sort of take on the issue of mental health, so that we can break down some of those barriers and start to address this, because those barriers prevent people from accessing support. And it's really unfortunate the longer we wait, the worse the situation becomes, and getting support early on is key.
Now, we heard earlier, speaking about barriers, of some of the programs available for seniors who often have barriers in being able to seek care and accessing care. Kara, can you just expand a little bit? You mentioned seniors in the early part of the program. Specifically, what type of programs do you offer for seniors' mental health, and where are those services located?
Okay, so again, I'd like to just sort of make the point that people over the age of 65, our geriatric population respond extremely well to treatment. Contrary to popular belief, depression is not a natural progression of aging. It's actually a very recognizable and treatable illness in the elderly. So most of the patients we see in our mental health seniors mental health program have depression or anxiety or dementia. So we have tailored treatment programs to address these problems. Again, our approach is an interprofessional one, where we're able to really leverage the expertise of various disciplines, whether that be social work, nursing, occupational therapy. We have a nurse practitioner on board to address some of the medical comorbidities that sometimes exist in elderly patients with mental illness. And we basically wrap around. A lot of our work is done in the community, in the home, because a lot of the clients we serve have challenges around accessibility and coming to hospital. The Mississauga Halton Lynn has been very supportive in seeing outreach for seniors as a priority, and they are excellent partners in that regard.
So for those who are watching at home who feel like they might know of someone in their family, or they themselves might feel like they could use some extra support or have access to some of the programs that you've spoken about, what's the first step? And maybe I'll start with you, Anita, quickly. For newcomers, where would they go?
Well, I think the first step, and it's great that they are ready to take that step, I think there are a number of supports and services available, and it depends on where they are, where they're living, what neighborhood they're in, and what particular issue they may be seeking support for. So one very logical place to go would be their family physician. But the other, in terms of community-based services, would be 211, which is an information and referral line. It works just like 411, but it is for the community. We have trained information and referral specialists that are available 24/7, and they also have interpreters that can speak a whole host of different languages as well. So whether it's day or night, if somebody's looking for support, 211 is a really good place to go for connection.
So anyone just picks up the phone,
That's
they call
right.
211,
That's right.
and they get access to this amazing service, it sounds
Yes.
like,
Yeah.
in any language that they might speak.
Exactly.
Wow, I wasn't aware of that, so I think that's great news for our viewers. 211, and that's all through United Way of Peel.
It's delivered by the region of Peel, but it is a United Way initiative across the
Okay,
province.
well, thank you so much, and again, stay tuned for our next segment on the mental health issues from Talk Trillium. Welcome back to Talk Trillium. We're talking about mental health today, and joining me now is Danusha Gronkowski, occupational therapist, and Jennifer Jones. You are a volunteer with the START program and a former patient.
Yes, I am.
So welcome both of you.
Thank you.
Danusha, maybe to start, can you describe the START program?
Sure. The START program has been around at the hospital for about 20 years now. It's a group therapy program primarily running between about 10 to 16 weeks that patients come in. It's a day program, so we run the program 5 days a week. Primarily our patients have depression and anxiety that are referred to us. They can be referred from their family doctor as long as they have a psychiatrist do a consultation with them. Most of the referrals come from psychiatrists. It's a very goal-directed program. We focus a lot on helping people find solutions to the problems that they're struggling with. It's a safe therapeutic environment that people really can do the work that they need to work on their self-esteem, on their assertiveness, on developing coping strategies to deal with the issues that they come to us with, have a safe place to heal from some of the difficult experiences and overcome fears and anxieties and, right?
Definitely.
That kind of thing. So.
And is it a unique program, and what are some of the benefits of this program?
I think it is a unique program. It's an intensive program, so I know there are types of programs like that in other facilities. Sometimes the facility will come and speak to us about our program. It's very well known. It's got an excellent reputation. I think the benefit in the group therapy environment is that people get to come in and meet other people that are struggling with similar issues. If they're just getting one-to-one treatment with their doctors, the doctors don't often have the opportunity to do the skill teaching that we get to do, and they really don't meet other individuals that are struggling with the same issues. So it can be very isolating to have depression and anxiety because people avoid a lot of things in their lives. So in that sense, a lot of the support doesn't just come from us as therapists, but it comes a lot from the other patients in the program as well. And it's an exciting program. I mean, any chance I have to talk about the program, I'll take it because it's so rewarding, it's satisfying. I've been there for the 20 years that it's been in existence, and I'm just as energized today as I've ever been in that program. It's pretty special.
So Jennifer, you have a pretty unique position. You are a volunteer with the START Day program, but you're also a former patient. Would you mind sharing with our audience just a little bit about your own personal journey as a patient?
I've dealt with anxiety and depression, mental health issues for most of my life. And sometimes I dealt with them better than others, and sometimes I wasn't quite on track. When I came into the START program, it was life-changing for me. It was absolutely life-changing. I actually did the START program twice, but the first time it was good, the second time it was amazing. I learned so much. The biggest thing I learned was how to manage my anxiety. And I went from having to sit by the door to being able to sit anywhere. I have a list of things that I keep on adding to. This experience is going on my list. I've never been on TV before.
Oh,
so
excellent.
In the anxiety module, we were asked to challenge one of our anxieties. And I challenged my claustrophobia by moving with a great deal of effort and tears and excitement, I guess, eventually, but not right at the beginning. I moved into the room one chair at a time. And I finished the program 4 years ago, I guess, yeah, February of 2011. And somewhere in February was the last time that I was claustrophobic. And my life has just changed so remarkably. Interestingly enough, by challenging my claustrophobia, I also challenged all my other anxieties. I am not an anxious person anymore. And
Well,
it's
clearly
amazing.
you're on TV
Yeah.
for the first time and you look so
Exactly.
relaxed,
I
Jennifer.
haven't gotten anxious today about this. I honestly had no anxiety. And I pointed out to Danusha that I was sitting with one person beside me and another person beside me, and I was fine. I wasn't the least bit claustrophobic or anxious about it.
Yeah.
It's amazing, absolutely amazing.
Yeah. One of the exciting things that Jennifer gets to offer the program when she's volunteering is she comes in our second session of our anxiety management module and tells her story to the group to motivate the other patients, which is really exciting because she's living proof that it works.
Yes,
That
change
change
is possible.
is possible.
And I am an example of change is
Yeah.
possible.
Now, speaking about your own personal mental health issues, it's really quite a sensitive thing to do. And I know that earlier in the show, we talked a lot about the stigma around mental health. So first of all, I want to thank you for helping bring that stigma down and speaking about your experience. But what has inspired you to be so open about this?
Well, the first thing is I'm not ashamed in the least about the fact that I have mental health issues. I didn't cause it, I didn't choose it, I'm dealing with it. But I also come from a very open family. We discussed everything. Sex, sexuality, mental health, the list goes on. I mean, we discussed everything. And I think by coming from a family that was very open, that helped me open up. But the other thing is too, that for my own needs, I needed to be open. If I needed a seat by the door, then I had to be willing to tell somebody that I needed that seat if somebody was already sitting there. And so sort of for my own needs, I've been open. But I believe that the more we talk about mental health, the less stigma there will be.
And you're certainly a role model in that way. Is there anything you want to share with the healthcare professionals that helped you along your journey?
Well, the START team, of whom I'm very proud to be part of the START team, but they know how much I love my job there and how much I appreciate them. I tell them all the time, oh, did you know what? Did you know that I love my job, Danusha? Did you know that? Did I ever tell you that? I am thankful on a daily basis for START. I was talking to somebody today about writing in a journal, and I said I always ended with gratitude. And my START experience is often part of my gratitude in my journal. It's amazing.
So Danusha, maybe over to you. You just mentioned that you've been with the START program for 20 years and yet you remain inspired and passionate about the work that you do. Can you tell us a little bit about why you still remain passionate and inspired?
You know, it's funny, Patty, because when I introduce myself to someone for the first time and that typical conversation, what do you do for a living, and when I mention I work in mental health with people with depression and anxiety, the first reaction I often get is, oh my gosh, that must be so hard, it must be so depressing to hear all those sad stories. And my response always is, no, in fact, it's extremely rewarding and satisfying to actually see people change. I feel extremely privileged that in the kind of program that we run, we actually get to help people move along that path and see them make changes. And that's what keeps me passionate. And my team, and you know, working with a team that I know I can count on, and we support each other, and you know, we get a lot of the positive energy back from the patients as well, from our clients, and I think it goes back and forth.
Definitely.
So
Great. Can you tell us a little bit more about what kind of exercises would you do with a patient in the program?
We have a variety of groups that focus on mindfulness exercises, so helping people to know how to regulate their emotions and settle themselves when they get very upset over something that's going on. Being more here in the moment rather than, one of the things that we think about in depression is that people often go back to their regrets of their past lives, and with anxiety they're projecting into the future, the what ifs, what's going to happen. So mindfulness is about being able to be present in the moment and work on that.
We could all benefit from that, I think.
Absolutely,
Yes.
absolutely. We do a lot of self-esteem work, so we'll have people developing affirmations, so when they're struggling with something, to just look at what's going on in their heads, their negative self-talk, and making changes around those things. Oh my gosh, there's assertiveness training. We use cognitive behavioral therapy and dialectical behavioral therapy as modalities, so there's a lot of detail in those sorts of things, but in terms of just skill teaching people how to remain hopeful, positive, take small steps forward, so setting goals. So we're very goal-oriented, as I said before. So sometimes people will compare themselves a lot to what they were able to do when they were well. So sometimes we have to sort of slow them down. Sometimes we have to use behavioral activation to kind of get them to move forward, so that they might be really stuck in their depression and be afraid to take those steps forward. So it's sort of very individualized in terms of what each client needs to support their progress and improvement.
And what did you find most helpful in the program, Jennifer, when you were going through it?
Definitely the anxiety module. Assertiveness module, I learned to be assertive, and that's been a great skill. Self-esteem, I still use my affirmation. We had an affirmation to do for the second session, right? And mine started out as, I am healthy, positive, and unbreakable. And now it's, I am healthy, positive, assertive, and unbreakable. And I use it sometimes if I'm writing an email or something, I'll use that as my sign-off. So there's just so much, but I think even connecting with people, even being able to say, I'm not the only person who has depression. I'm not the only person who has anxiety. I'm not the only person who thinks, oh, I don't want to go to START today, and but I know that I'm going to make a difference by getting there. That was certainly when I was a client there, that I didn't want to go sometimes, and I knew that it would make a difference.
And I think for others who feel some fear about opening up about their mental health issues, that could be a good key, is that they're not alone, they're not the only ones with similar kinds of feelings of anxiety and depression, and I think you found that helpful.
It's been a very exciting time over the last decade to see so much anti-stigma campaigns coming out with Clara Hughes and Well Let's Talk and that kind of thing. So it's exciting to see it's becoming more and more open and common.
Well, I want to thank you both for joining us on the show, but most importantly for the work that you do each and every day, year in and year out, both as a volunteer, as an occupational therapist in the program, Danusha. So really thank you for sharing with our viewers all about the work that you do.
Thank you for having us here.
Yes.
Yeah, absolutely.
I felt really honored to be asked to be here. So.
Okay, so stay tuned. Welcome back to Talk Trillium. Joining me now is Dr. Jonathan Beard. He's the Director for the Child and Adolescent Program at Trillium Health Partners. Welcome, Dr. Beard.
Thank you for asking me here.
And we also have Linda Lee Berkowitz. Linda is the Director of Clinical Services for Peel Children's Center.
Thank you for inviting me.
Yeah, welcome. So Dr. Beard, we're going to start with you. I might call you Jonathan along the way. Mental health can start at almost any age. Can you describe for us some of the most common mental health issues in children?
Yeah, I think most commonly we see anxieties of all types, from the quite young all the way up through the lifespan. An anxious kid often will end up being an anxious adult if they don't get treatment early on. So anxiety would be probably the predominant illness that we see with the kids, but we also see depression. And ADHD usually surfaces at a young age. And when it comes to us at Trillium to see a psychiatrist, it's usually complicated by other things like anxiety or a learning difficulty or something like that. So in addition to ADHD, then we see emerging at a young age some disordered eating, which may return later in life in the late 20s, early 30s, and also first break bipolar disorder. Bipolar disorder is an adolescent illness. We see that quite a bit, along with psychosis.
So you mentioned ADHD. Could you just explain what ADHD is to
Yes,
viewers?
I'm sorry. Yeah, ADHD, Attention Deficit Hyperactivity Disorder. It used to be called ADD about 20 years ago. They changed the name then, and now we would describe it as ADHD inattentive type or ADHD hyperactive impulsive type, or most commonly ADHD combined type, which would be both.
So what would be the range of ages that you would see in young children? What age would it start potentially?
Typically, at our clinic, we would be seeing kids just before grade school, maybe age 5, age 6. And before age 5 or 6, they would usually go to another clinic, more often behavioral or developmental clinic. But we would see kids 6 to 18. They would age out at age 18. And like I said, some of the more common illnesses are the ones that I described to you. But there's also a population that can get missed, and that's the transitional age youth, age 16 to 24. And we have a program at Trillium, the TAY program, Transitional Age Youth Program, where we have a team that works with the patient as well as the family, because there's often a family component that is contributing to the illness of the adolescent.
Linda, maybe could I ask you to describe some of the programs and services that you offer in the Peel Children's Center?
Certainly. We have a range of services. We have services that start from really the least intrusive to the most intrusive services. So that can be starting from a single session that someone can have to a counseling program, and then moving to the more intensive range, which would include residence, day treatment, could include respite services. So it ranges on a continuum depending on really individualized needs. So rather than the program being given to a person, we really try and have the program work with what the unique needs are of each individual person is as they come. And the programs and services we offer all have some evidence behind them in terms of research so that they've been proven to be effective in terms of making changes and supporting children and parents and the youth. One specific program that's been quite popular is Tangerine Walk-In. And that's a program we started about 3 years ago. There was some new funding that came in from the ministry, and we didn't have a walk-in service before. But what we found was that parents could wake up one day or have some issue with their child, and they needed just one session of service to come in to talk about a specific issue they were struggling with. And that service is available 3 days a week. It operates Tuesday, Wednesday, and Thursday. And there are 2 partners we work with, Rapport Youth and Family Services and Associated Youth Services Appeal. And we offer Tangerine out of each of those locations 1 day a week. Each agency has them. Ours happens to be on Wednesday, and on Wednesday we also offer services in French, so that if clients need the services in that language, it's available to them. But
where are they located?
They're located, the best place to go is actually at our website, which is tangerinewalkin.com, and then the hours and locations are in there.
So tangerinewalkin.com.
Yes.
Thank you, that's excellent. Maybe Jonathan, is there any difference in the signs and symptoms of a child or a youth in terms of mental health presentation compared to adults?
Well, I think more commonly we're going to see some somatic, physical complaints by the children, headaches or stomach aches that may be representative of something that internally from a psychiatric component would be going wrong, something that they can't manage. It could be anxiety, it could be depression. So we will see that. And we also may then see some substance use difficulties. They may be using, marijuana or alcohol. And so we start seeing that. And we do have programs at Trillium that can help address that. And then, as I mentioned before, also in the early years, we see some other illnesses that may be emerging around that time. Irritability, also a key component. And with the younger population, one of the ways that they exhibit their mania, like for bipolar disorder, is through rageful, aggressive episodes. So that we can see with the younger population.
Now, you mentioned you had programs for children and youth at Trillium Health Partners as well.
Right.
Can you describe some of those programs for us?
Yeah, we have a number of programs. I'd mentioned the Transitional Age Youth Program. That is one concurrent disorders program, which often that's for substance use difficulties, concurrent with a mental health disorder, anxiety, depression, bipolar disorder. So we can use that component at Trillium. And then we also have an autistic spectrum disorder clinic at Credit Valley Hospital that can see children and diagnose and treat them as well. Other things that I'd mentioned, like disordered eating disorder clinic, is actually out with one of our partnering agencies, along with a gender identity clinic that also we will refer out to a partnering agency for that.
Now, you mentioned a concurrent disorder clinic. Just for our viewers, I think concurrent means having two things at the same time.
Correct, yeah.
So you could have a drinking problem along with a mental health disorder of some sort. Do
Yes.
I understand that correctly?
Yeah, Patty, that's exactly right.
Okay, great. Now, Linda, I understand you also have a program often with children and youth. Because it is children and youth, it becomes a big family issue. It's not just the individual patient, but it's the family that's impacted as well. What programs do you have to support families?
So in Peel, we have almost 40 programs across the range of services that are available. And depending on the age, most of our programs work with the child and youth and their parent. There's only a few services that work with youth independently, because the parents really are the ones, they are the expert in their child, they know their child best, and so we really rely on the parents and their experience to come and help support their child and youth. And I think, as Jonathan was saying, sometimes what does occur is issues that are happening in the family. So if a parent is experiencing stress, they've lost employment, they're having difficulty with housing, they don't have enough food, all of these stresses and some of their own experiences they may have had in their own growing up can often influence the mental health issues that their child and youth are experiencing, because the parents may either not be available to attend to them, or they just may be preoccupied with some of their own issues, or they may be struggling with their own mental health issues. So often it's an opportunity to really help mobilize some change in the parents at the same time as working with the children and youth. Other situations we have where the child and youth is coming with the mental health issues that are strictly related to their own either genetic or physiological makeup that they're coming with, and the parents, are there really to learn strategies and skills in terms of what they can do differently to help support them and to understand a little bit more about what their child or youth is experiencing, and to develop a broader understanding to provide better skills around specific to that child or youth's needs.
I know you have a program, it's called Peel Wraparound Process for Children's Mental Health. So can you describe what that is? It sounds interesting.
Well, it's a wonderful program. That program is based on something called a system of care. And what it really is, it's for families, I think, who are having multiple issues. So they're much more complex. They're having issues in multiple areas, including mental health. And it's basically the family is wrapped around by a team. And what happens is they initially meet with a wraparound facilitator who meets with the family and asks them to identify one specific domain in their life that they're really struggling. It can be around their home, it can be around their faith, it can be issues in the community, it can be school, And they focus on one domain, and you build in team members that will help support changes in that domain. So let's imagine it's a school issue. You may get a teacher involved, you may get a teacher's assistant involved, you might get a friend who's tutoring. So you look at all the people that can support the issues around school, and you develop a team to support them. Some have with some professionals on them, and some that are not professionals. They can be family friends. And eventually the goal is that the facilitator is able to move out of the family, and that team becomes self-sustaining and changes as the different domains come up. So if a new issue comes up, they now have the skills to facilitate building a new team around that new domain. So the idea behind wraparound is to get yourself out of the work and then have the family develop a team that becomes self-sustaining over the length of time that they need the support.
Excellent. It sounds very comforting.
It's a wonderful program.
Wrap around.
It is.
And maybe just in the last minute, Dr. Beard, any advice for any viewers who feel like they have concerns about their children's mental health? What would be their first step? Where could they go for more information? Any advice?
Well, I think the important thing would be to get treatment as soon as you can and as early as you can. And that would either be going to the emergency department, and at Trillium now, RBC Bank has helped us develop an urgent care pediatric mental health clinic. Get to the emergency department where you can be then directed to the appropriate services, which could include something at Trillium where we do psychotherapy individually in groups, some family-based work. And we also refer to Peel Children's Center and Associated Youth Services Appeal for services that we don't provide, mainly the intensive in-home services, but the key would be to get it addressed.
Thank you so much for sharing that advice with us and our viewers today. And thanks for joining us at Talk Trillium. Today we've talked about mental health issues and how we're creating a new kind of healthcare for a healthier community in mental health. Thanks for joining us today.